So, now let us look at what are those 8 core components which are prescribed by World Health Organization in the 2016 guidelines. According to these new guidelines, we have got 8 core components, 11 evidence-based recommendations, and 3 good practice statements. And I would request you to give the attention that the term or the word or the alphabet R stands for recommendation, and GPS stands for good practice statement. And while actually we are going to understand and also review the further slides, let us give focus and attention especially to those recommendations and good practice statements which are related to the facility level IPC management. So, now let us look at each and every individual component which is prescribed by World Health Organization. Now, the first component relates to IPC programs. This core component is both strongly recommended and also prescribed as a good practice statement by World Health Organization based on all the studies and all the evidence which has been received from all over the world. An IPC program with a dedicated trained team should be in place in each acute healthcare faculty and facility for the purposes of preventing hospital acquired infections. Today, when we are going to talk about all the other 7 components and this component, I would be focusing predominantly on healthcare facility level rather than on national IPC programs, so that our module can be as practical and as implementable as possible. In order to achieve this core component, as we rightly said earlier, that we first and foremost need to have a dedicated and trained professionals. They should form a multidisciplinary team, and then this team should have a very clearly defined objective. Of course, the facility management, that is the owners of the hospitals, that is the government machinery, they had to give adequate support to these teams in order to achieve this core component. Of course, having a good microbiology laboratory is going to be first and foremost necessity in order to have this core component delivered. Now, coming to the second component, it is about the guidelines. The guidelines which are evidence based, which are supposed to be giving a overall understanding of how do we implement the systems and process within our healthcare facility level. This component, in order to be implemented, we need first and foremost the expertise and local prioritization and providing the resources for implementation, then monitoring the implementation, and also we need to ensure that healthcare workers are educated on recommended practices. Coming to the component 3, it is about infection prevention and control education and training. Again, World Health Organization has mentioned this particular component as a very strong recommendation and also a good practice statement. If we look at the success or the key success factors for making a IPC a viable proposition within the healthcare system, we need to really start these programs and educate the people when they are young. That means we had to start the education about IPC from pre-graduate level itself, then continued that through the postgraduate courses, and also give continuous training when the people are in service. We also need to evaluate continuously the impact of the training which we are giving to the people, so that we can keep revising the programs to fit to the requirements and also to fit to the understanding and the psychology of the people who are going through these programs. One more very important factor in making this core component successful is to collaborate with local academic institutions. Going into the core component 4, this is going to be about hospital acquired infections surveillance. There are again we are going to focus on at the facility level. Our people should be having standardized definitions, appropriate methods, a good quality of laboratory support, and quality control in order to have the surveillance in place and also surveillance as a successful core component. Of course, as we mentioned several times in the past, training and expertise is definitely needed in order to do the surveillance in a way how it is going to give us the enough input in order to make our practices much more better, much more safer. Coming to core component 5, in the beginning itself I have said that your attention is required for this particular core component, which is called as multimodal strategies. We already have talked about the term or the definition of multimodal strategy. The core of this particular component is build it, teach it, check it, sell it, and live it. I am sure with these 5 words you would have definitely understood the essence of multimodal strategies. When we say build it, build actually a system, multiple kind of elements and the components which are to be implemented in an integrated way to improve the outcomes and the change the behavior. Teach it, whatever we learn, whatever are the recommendations, etc., try and help your colleagues to teach it so that they also become on par with you. Check it, especially in the healthcare facility level. Unless you are going to continuously do the checking, you are never going to have the improvement. So it is going to be very, very important. Fourth element of it is sell it. Why sell it? When we are talking within the healthcare institutions, sell, probably the people will look at with surprise, but believe us, with the experience within the healthcare system, this is a very, very, very vital element in order to make IPC workable, IPC implementable, IPC to be resultative within the healthcare institutions. If we are not going to sell infection prevention and control as one of the most important issues to be taken care of, and unless you are going to sensitize the people, it is going to be very difficult to achieve the optimal level of infection prevention and control. Live it. It is understandable. If we are going to only preach, if we are going to sell, if we are only going to teach, nobody is going to actually follow us. We had to set a kind of an example. We had to be the drivers of the change. If we had to be the drivers, we had to live it. That is the only way how we can attract the attention and how we can make people believe in IPC. So now let us look at the component 6. This is about monitoring and audit of infection prevention and control practices and taking the feedback. So we all know that if we had to change a behavior, it is a very lengthy process, and to achieve a behavior change or other process modification, we need to really work very hard with all the stakeholders, sensitizing, educating, and also taking them on our side in order to make it as a successful program. So if we had to do that behavior change or the process modification, we had to do continuously the monitoring and audit, find out where are the gaps, and use that monitoring and audit information as a basis in order to prescribe some of the changes what had to be implemented. And we had to also ensure that we are going to document the progress and also the impact what these core components, what these practices have the given healthcare organization or even at a national level. Coming to core component 7, we also need to assess what is the workload, how the staffing is done, what is the level of bed occupancy within a given healthcare facility level in order to prescribe adequate policies and adequate systems for the given institution. There are standards which are prescribed for bed occupancy. Usually it is being said that at least one infection control and prevention person or healthcare worker had to be there for 100 beds. If we are not going to have that kind of staffing level, then we will not be able to adequately address infection prevention and control practices with a huge patient workload. Overcrowding is also recognized as a public health issue, especially if we are talking about our government hospitals. Overcrowding is not an exceptional issue, it is a routine issue, and unless we are going to understand that problem and find adequate measures in order to regulate that, we will not be able to provide the right kind of recommendations for the given healthcare system. Then the last component, it is about built environment, materials and equipment for infection prevention and control. So I would not go into the detail of all the environment and materials and equipment, but I would like to definitely make a mention of 2-3 areas which are going to play a very vital role. Number one, that is clean and hygienic environment. We had to have appropriate clean and hygiene environment. If we do not have that, it is going to be very, very difficult to implement infection prevention and control practices. Water, sanitation and hygiene, this is again very important component, and especially when we are talking about water, sanitation and hygiene, having adequate infrastructure, adequate kind of material. For example, if we talk about hand hygiene, we need to have adequate antiseptic preparations available to all the staff at all the places. Water had to be available so that they can wash at appropriate intervals, which should improve infection prevention and control practices within the given scenario.